there's someone asking in the chat, Krista Bluff, is there any research around toxic metals and increased detoxification with sulforaphane? So we mentioned some of these carcinogens, but has there been any evidence on metals?
There's been some. I'm not. I mean, I'd have to go and dig those papers out for you, Krista, because I'm not intimately familiar with them, and we didn't do them. But since you mentioned, so the answer is yes, and I'll try to find you those references. But that brings up the question of pesticides and other toxins. You know, we have talked about air pollutants, and we've talked about a lot of disease states and protection against cancer and so on and so forth. But others, a number of years ago especially, have looked at things like paraquat toxicity, and there are a number of other pesticides. I can't at the moment remember which ones they are.
Rotenone?
Rotenone, I think, is one. Yeah, people have looked at the ability of sulforaphane to detoxify them or to enhance the elimination of them. So, and certainly we've done, my colleague Tom Kensler and that whole team has, I mean, they started out in China, in these China studies, looking at aflatoxin, which is different than metals and is different than pesticides, but it is a potent toxin and carcinogen that is actually present in peanuts and corn in the part of China where we were working. And clearly, and this is sort of a model for the metal and the pesticide detoxification. Clearly, aflatoxin is converted to a derivative bound to compounds which allow it to be more readily excreted in the urine. So this is something that this is what we call detoxication or detoxification. And indeed, it's pretty widespread because, so this is probably involved in a subsequent question, but a lot of this is because of the upregulation of glutathione. Glutathione is the body's most predominant detoxification mechanism. It's present at very high levels in things like the macula of the eye, the back of the eye, in the retina. And it's a tripeptide, meaning it's made up of only 3 amino acids, and it is a very potent antioxidant that is endogenous. It's part of your body. But what sulforaphane does is it cranks up the enzymes that are responsible for synthesizing or resynthesizing glutathione. And so it makes more glutathione available. And once glutathione is sacrificed and oxidized, it remakes it. And so that's, I mean, it's a long way. All my answers are long ways of answering simple questions, I guess. But that's a way of saying that's sort of where sulforaphane comes into that detoxification pathway. One of many ways, but it's probably one of the most important ways.
Yeah, we are going to talk a little bit more about glutathione on another question, but I just want to ask you, is specifically the, you know, there has been clinical studies that it increases glutathione in the plasma and in the brain. I don't remember how far out those clinical studies went, but as you were saying previously, with the air pollution studies that you had been collaborated with in your colleagues in China, the activation of the NRF2 system did not stop as long as you were continually taking the broccoli sprout extract, right? So the glutathione levels would keep going up if you were. It's not something that just goes away over time.
Right. Well, they won't keep going up to, you know, forever. Well, I mean, they'll keep being
continue,
replenished.
Right.
Yeah,
exactly.
Yeah. So if you insult your body with a toxin that is detoxified by glutathione, yes, there'll be a dip in glutathione levels. What actually happens is the reduced form of glutathione turns into the oxidized form, and then the reduced form, glutathione, is regenerated. So that cycling happens more efficiently, and indeed the overall levels of glutathione are somewhat elevated.